Hello and welcome. Today we're diving deep into a rare but fascinating heart condition, cardiac paraganglioma. This video will explore what it is, why it happens, how it's diagnosed, and what can be done about it. Join us as we uncover the intricacies of this unique tumor affecting the very core of our being, the heart. So, what causes a cardiac paraganglioma? The etiology isn't always clear-cut. Most cardiac paragangliomas are sporadic, meaning they occur randomly without any known genetic predisposition. However, a significant portion are linked to genetic mutations. These mutations often involve genes associated with hereditary paraganglioma, pheochromocytoma syndromes. When these genes are mutated, it can disrupt the normal regulation of chromaffin cells, leading to the uncontrolled growth and proliferation of these cells into a tumor. Environmental factors may also play a role, though this area requires further research. To understand cardiac paraganglioma, we need to understand the pathophysiology. Paragangliomas are neuroendocrine tumors arising from extra-adrenal chromaffin cells derived from the neural crest. These cells are normally involved in the production and release of catecholamines like norepinephrine, epinephrine, and dopamine. When a paraganglioma develops within the heart, specifically near the atria or ventricles, it can release excessive amounts of these hormones into the bloodstream. This hormonal surge leads to a cascade of effects, including increased heart rate and blood pressure, potentially causing a range of cardiovascular symptoms. The tumor's size and location can also physically compress heart chambers or obstruct blood flow, further disrupting normal cardiac function. Prolonged exposure to high levels of catecholamines can also damage the heart muscle itself, leading to cardiomyopathy or arrhythmias. Cardiac paragangliomas are incredibly rare. They account for less than 1% of all heart tumors, and even amongst paragangliomas overall, those located in the heart are uncommon, representing a very small fraction. Because of their rarity, accurate epidemiological data is limited. They can occur at any age, but are more frequently diagnosed in adults between 30 and 60 years old. There doesn't appear to be a strong gender predisposition, with incidence rates being relatively similar in men and women. The signs and symptoms of cardiac paraganglioma can vary greatly depending on the size and location of the tumor, as well as the amount of catecholamines it releases. Some individuals may experience no symptoms at all, while others suffer from a constellation of cardiovascular issues. Common symptoms include palpitations, rapid heart rate tachycardia, high blood pressure hypertension, excessive sweating diaphoresis, headaches, and anxiety. In more severe cases, patients might experience chest pain, shortness of breath, dizziness, or even fainting. The episodic release of catecholamines can cause symptoms to come and go in bursts, mimicking panic attacks or other anxiety disorders. Diagnosing a cardiac paraganglioma requires a multi-faceted approach. It often begins with a thorough medical history and physical examination, where the doctor will look for signs and symptoms suggestive of catecholamine excess. Biochemical testing is crucial, involving the measurement of catecholamines and their metabolites, such as metanephrines, in blood and urine. Elevated levels strongly suggest the presence of a catecholamine-secreting tumor. Imaging studies are essential for visualizing the tumor itself. Cardiac RI is particularly useful, providing detailed images of the heart and surrounding structures. Other imaging modalities, such as CT scans and nuclear medicine scans like MIBG scintigraphy or PT scans, can also be used to confirm the diagnosis and rule out other potential causes of the symptoms. A biopsy may be performed in some cases to confirm the diagnosis and determine the specific characteristics of the tumor cells, although this is often avoided due to the risk of triggering a hypertensive crisis. While classifications are not as strictly defined as with other types of cancers, cardiac paragangliomas are generally considered either functioning or non-functioning, based on whether they secrete excessive catecholamines. Functioning tumors are the most common, causing the characteristic symptoms of catecholamine excess. They can also be classified based on their location within the heart, such as atrial or ventricular paragangliomas. The primary treatment for cardiac paraganglioma is surgical resection, aiming to completely remove the tumor. Pre-operative management is critical to control the effects of excess catecholamines. Alpha-adrenergic blockers are used to lower blood pressure, and beta blockers may be added after alpha blockade to control heart rate. During surgery, careful monitoring and management of blood pressure are essential to prevent hypertensive crises. In cases where surgical resection is not possible due to the tumor's location or size, other treatment options may be considered, such as radiation therapy or targeted therapies. Medical management with alpha and beta blockers may also be used to control symptoms. Regular follow-up is crucial to monitor for recurrence or the development of new tumors. Unfortunately, there are no established methods to prevent the development of sporadic cardiac paragangliomas. However, for individuals with known genetic mutations associated with hereditary paraganglioma syndromes. Genetic counseling and regular screening can help detect tumors early and manage them effectively. Avoiding potential triggers of catecholamine release, such as certain medications or stressful situations, may also be beneficial for individuals with known paragangliomas. The prognosis for cardiac paraganglioma depends on several factors, including the tumor size, location, whether it's benign or malignant, and the completeness of surgical resection. Complete surgical removal generally offers an excellent prognosis with a high chance of long-term survival. However, recurrence can occur, particularly in cases where the tumor is malignant or incompletely resected. Recent research is focusing on developing new targeted therapies for paragliomas based on their specific genetic and molecular characteristics. This includes exploring the use of tyrosine kinase inhibitors and other novel agents. Advances in imaging techniques are also improving the ability to detect and monitor these tumors more effectively. Further research is needed to better understand the biology of cardiac paragangliomas and develop more effective treatment strategies.